Hello and welcome to the Sit Rep. I am Marine Corps veteran Paul Corbett, and I am joined by Army veteran Sarah Carnes. Thank you, Sarah, for being here.
Thank you for having me.
It's very interesting because a lot of the people in the VA, a lot of people in the government, period, wear multiple hats. And usually those hats have something to do with one another. But you serve as the librarian for the VA Medical Center, which I'm sure a lot of people don't even know that VA Medical Centers have libraries.
Right.
But you serve as the VA Medical Center librarian and also the emergency manager, which I imagine with COVID-19 right now, it's got to be absolutely bonkers for you.
Yeah, it is. I'm mostly just doing the emergency management side of the house. But even on the way here, I was trying to help out getting some audiobooks to one of our veterans over in hospice, as a matter of fact.
So how did that come about? I mean,
Yeah. So my background actually is in emergency management, but it's been a combination of multiple jobs that really culminated in that. When I was in the Army, I was a medical service corps officer, and I was in field units. That was my preference. I didn't want to just be in hospitals. I wanted to be out front. And so I spent a lot of time learning tactics and multifunctional logistics and how I could best place my medics and my treatment folks and all of them to be able to support infantry and armor units. And so initially I was with the main support battalion and then with the forward support battalion. And we did that in training and we did that in real time in deployments. But in all of those modes, we had to do a lot of planning ahead of time for different contingencies. I think anyone who's been in the military, we sort of take it as the norm that we're going to think of what else could go wrong or what are the threats or what are the concerns. And so I got trained to do a lot of that, and then I had to do a lot of that. And when I was in Albania, I had done a country study and assessed what concerns we had with zoonotic diseases, what supplies we needed, who we were supporting, and done a big country study to prepare ourselves to go there. And that was one of the things I really loved, making sure that I did everything I could to protect my medics and get them ready to support whoever they needed to. And in the midst of all that, I started doing a lot of collaborative planning with other medical units. I'd mostly been with multifunctional units, but it was the first time that I'd done as much detailed planning with medical units at the corps level and echelons above corps. And I really got to see how all of it worked together back to the fixed facilities like Landstuhl in Germany. And I started appreciating a little bit more the stuff that was in garrison. I admit that I really preferred field before that. And so when I was in Albania, I met one of the planners from Landstuhl, and I thought, wow, this is something that would be interesting to explore as part of my career. So when I returned from that deployment, I got in touch with the executive officer of the Landstuhl Medical Center. And I said, hey, I understand that you need a chief of security plans and ops. And that's really what I did in a field environment. I'd really like to do that in a garrison environment. And ultimately, I got that position. And what it ended up being, a big part of it was really when you translate what we do in the field to a fixed facility, it's emergency preparedness. You're planning for all these different contingencies to make sure you can still provide medical care in any type of crisis that might come your way. And then we actually got tested. We had very unusual scenarios at Landstuhl where a friend of the U.S. government, there was an assassination attempt on him, and so we had to hide him in the facility. Then we had people coming to the facility trying to find him and get him. And so I worked a lot with the MPs and the local government to make sure that our plans were dovetailed together, but that we actually were able to protect this person and then evacuate him out safely. And then we had a number of other crises that occurred or that we were preparing for. And then I got a call from, it was Sam Franco, who was our XO then. And he said, Sarah, I want to let you know, this is not a drill. We need to start the Incident Command Center. The USS Cole's been bombed. And I said, Roger. And I came on in and we stood up the Incident Command Center. And I had just some phenomenal NCOs who worked for me. And so we all had been, in the field. We'd all done a lot of planning together. We'd worked really hard to prepare ourselves, and it just was like clockwork. It was one of the most beautiful things I'd ever seen. And it was really like that across the board in Landstuhl, where people were so devoted to their job of making sure we took care of our fellow comrades in arms from the Navy, that people just had all this energy and strength and resilience to be able to respond in whatever way we could. And on top of that, we were working with the FBI because they were coming in to do investigations, and they were testing the sailors to see what they found on them. And we were working with media a lot, and because they were coming to Landstuhl to see what we were doing. We worked with the Air Force to bring those planes in from Yemen. And we worked with the families, bringing them in, because we didn't yet have a Fisher House at Landstuhl. So it was a really comprehensive response, and everybody just really came together to take care of those sailors, those families, and to make sure we could get them home safely. And it was, I have to say, absolutely life-changing. I mean, I think there's many moments like that in the military, but that was just sort of this incredible experience where I'm talking to people who are at the ER, and they're seeing the vehicles come in from Ramstein from the air base, and we're ready to take care of those sailors. And then 4 days later, we can see these, and many of them were kids. They're 18, 19 years old. And we had been able to stabilize them and help them get ready to go back home. And I just thought, this is really powerful. This is like everything I'd ever done had come together. And I loved it. I loved being a part of that and supporting the effort of our doctors and nurses and all the leaders to be able to care for these sailors. And so when I left the military, I looked for something like that. And lo and behold, I moved to northern New Jersey, and 9/11 happened. And I thought, you've got to be kidding me. I'm out of the military and this has just happened. How can I help? And it was really difficult to not be in a position to do some good. And I was managing an ambulance company for Atlantic Health System in northern New Jersey. And I liked what I was doing, but it couldn't feel anywhere near as purposeful as what I'd done in the military. So I think, like a lot of veterans, that was really hard. And, I went into the Bronx to try to get into a reserve unit. I did everything I could, and I just couldn't find a way to transition back to where I felt like I could do something with what I'd done before. And then 6 months later, the chief of security for the Atlantic Health System said, "You're wasted in what you're doing. We need you to manage our strategic and global assessment for emergency preparedness." So then I did that for a hospital system. And we had SARS, we had smallpox concerns. I worked with hospital associations in New Jersey and New York, and the public health departments in New Jersey and New York to prepare for mass vaccinations and pandemics. I started going to a bunch of different conferences and presenting on our plans and helping really mold what we as Atlantic Health System did, not just with other health systems and with public health, but with the Business Roundtable, which was at that time led by Home Depot, and all these different community entities working together. Because if there was one thing I learned in the military is no one's an island. You cannot accomplish anything by yourself. And it was that team approach that was so successful at Landstuhl and everywhere else I'd ever been. So that's what I tried to foster. And what I'd found out, which was the same thing I found out in the military, is everybody was making assumptions about who was responsible for what, because the plans weren't shared. So that was a big role that we had, was to share it with everybody. It's all about everybody having the right information to be able to make the decisions and take the actions to accomplish the mission. And if you think somebody else is doing something and they think you're doing it, which is exactly what we found, then it's not going to happen. And somebody's going to suffer because of that. Right. So I was working again with a lot of people who really cared about making sure we were ready, because 9/11 had just happened. People were very motivated and really wanting to be ready. And ultimately, over the course of about 3 years, we got to a really good place. I wanted to go and get my master's. I actually got into John Jay to do my emergency management master's and was going to go that route. And then I got an offer to work with the National Emergency Response and Rescue Training Center. So I became an adjunct instructor out of Texas A&M, training communities and federal agencies and states and military organizations around the world in preparing. And I focused on the EMS paramedic side and the hospital side. So 1 week I'd be, at Fort Bliss helping out with their preparations. The next week I'd be in Maryland helping them write their smallpox plan. And then I'd be in Japan helping them, the Air Force do an exercise, a full base exercise with multiple bases throughout Japan. And I loved it. So for 3 years, I traveled and did a lot of that training and planning. And I just really loved it because I was working with all these almost everybody was retired military, law enforcement, or fire. So I was working with folks who'd responded to wildfires in California and who had really brought incident command from the military to fire, and then nationally. I worked with police and fire chiefs from all over the country who'd, responded to bombings, the Atlantic Olympics bomb, the Oklahoma City bombing, 9/11, all these people who really had been there and done it. And I was learning from them and then being able to share those wonderful best practices with others and sharing what I had learned in my experiences. But a big part of it was research. A huge part of it was research. And so I just spent a lot of time studying, just like I did in the Army. What are the threats? What are the concerns? What are the ways that we can mitigate that? And then how can that be tenable in a community, whichever community we were working with? So that's where I was in emergency management for a while. And I did consulting after I stopped traveling for 3 years. I had a child, and so I couldn't travel all the time. And then I was a military spouse for 13 years. So I did a lot of consulting and a lot of planning, but I wasn't full-time doing emergency management. And I started thinking as my daughter got older, what I wanted to get back into. And I thought, emergency management is going to mean really long hours again and probably travel. So maybe I want to do something that's somewhat related to that, but maybe a little more stable. And so I learned about, and I loved working in healthcare still. So I wanted to get back to that. And a friend of mine said, "Oh, you should be a librarian." And I just started laughing. I thought it was the most ridiculous thing I'd ever heard. I'm like, librarian? Where does that come from? And they just thought, well, I was an English major, so maybe I'd like doing that. And I thought, no, I do not want to be just sitting in a public library. I think I'd be really bored. They said, well, there's other options. And I thought, all right. So I started looking into it. And I found out there was such a thing as a medical librarian or a clinical librarian. And that's all about getting information to people to have them make decisions to help out with someone's care. But then I also found out about disaster information within the medical field. And I thought, ooh, that's everything. That's all the stuff that I like. And so I ended up thinking ultimately and actually specializing in disaster information. I thought I'd go work with the National Library of Medicine. And I did a huge project with the Disaster Information Management Research Center, DIMRIC, and with the state of Massachusetts. And I thought, sure enough, I'm going to go there. But they had a hiring freeze. And so the next wonderful thing that fell into my lap was the opportunity to work with the VA as a clinical librarian. And so that's how I ended up here. But when things started ramping up for COVID-19, I started hearing people talk about it. And I said, I've got some background. I'd be able to help, if you need some help or any advice. And about a month went by and they said, yeah, we're going to detail you as the emergency manager. And I was like, all right. So that's where I ended up. Yeah.
That's awesome. Wow. So you have tons of experience in emergency management.
I'm very old.
Management.
Yeah.
And not so much as a librarian.
No, I've only been a librarian for 3 years. And one of those, actually the first few months, I was still finishing up my degree. I was a TA and I was working here. So I was already working here as the librarian while I was finishing up my degree program. To be fair though, my degree program is a 72-hour credit program. So it was a pretty lengthy process to become a librarian too. But that's sort of the simplified term. The real term is librarian information science, because it's all about finding that information that's useful and giving it to people in a useful format that they can then use for whatever their mission is.
And so when you started out as a librarian with the Department of Veterans Affairs, what surprised you the most about it? Like, I'm sure you came into it with some expectations.
Yeah. I actually had some trepidation. I mean, I think like a lot of veterans, I wasn't sure what to expect. I mean, we all hear the rumors about the VA. We all think, oh gosh, what's it going to be like? And I certainly had no idea what it was going to be like as a librarian, whether or not it would be something that was needed, because there hadn't been a librarian here for more than 6 months. And the person before me was quieter and only here part-time. And I thought, oh boy, I don't do things that way. So let's see how they handle that. But I was really more than pleased. I was thrilled because I am so busy as a librarian getting information to people and because they're asking for it, because they want to provide good care for veterans. As a veteran, that has been the most gratifying thing to experience, is that I can't keep up with the requests for information because people want to provide the best individualized care for some people with the most complex concerns with either their mental or physical health. So honestly, it's been a great surprise to have I just am really, really thrilled that I get to help support many of the doctors and nurses and psychologists and social workers who are dealing with some of our most complex problems.
And so I imagine a lot of the people in the audience right now might be thinking of you just sitting there at a computer and, like printing stuff out and then handing it to a doctor who hands it to a patient. But you actually have on campus an entire building that is a literal library. I mean, there's thousands of books in there.
Yeah.
And there's lots of individuals, lots of veterans who live here on campus who go there and do their reading and look at the newspaper and magazines and all the normal stuff like a regular public library.
Yeah.
That was one of the things that really surprised me.
Yes. So that's one of what I love to surprise other people with, I think. I actually didn't know I was getting a library when I got hired because the clinical library role, I know that. So I should have said that was my first big surprise. But the clinical librarian role really isn't stuck just in an office. We go wherever we're needed. And so I call it the forward support librarian, because I'm supposed to be where I can be most useful. That can sometimes be just on the computer sending something to someone, but oftentimes it's actually rounding on the unit with the medical team. And as they review a patient's case literally at bedside and they have questions, I write them down and I get back to them, or I share with them right away what resource they can turn to. So there's that aspect. I also attend clinical conferences where I'll sit in with a group of our psychiatrists and I will have already prepared for several clinical questions, but they'll ask for additional information and I'll give them a summary of what the research says. So it's kind of a country study, but on a patient. And so I'll have looked at the medical record and taken a look at where the literature supports maybe application to that patient. And so that's the main part of my job, what I was hired to do. But what I also had is maybe the implied mission that my first boss really wanted us to continue was providing care directly to veterans, because Bedford is a different flavor of VA. We have the largest assisted living population in the VA. We have over 240 patients who live here full time. And I don't think I understood the breadth of that population's needs because I just had never been in that position, that experience before. But I knew when I walked into the library, we needed to improve it a lot. It had been mostly mothballed because there hadn't been a librarian to manage it. There were volunteers who were delivering items to some of the units, but it wasn't informed with information about assistive technology or, I don't know, maybe different ways of suggesting options for people for entertainment, not just reading, because it's not just about books, honestly. And especially for patient education, because a lot of times patients may say, and veterans are really good at this, like, yeah, got it. I totally understand what you said. And then afterwards, I have no idea what that meant. So I wanted to foster a combination of not just providing service directly to the staff, but also to the veterans themselves, whatever that meant, whether it was information about their circumstances health-wise, information for their family members, because in many cases it's the family members making decisions or just who need some more peace of mind. And so I wanted to be a resource to them. And then I also wanted to provide a service that was to improve quality of life. I knew walking into that library that we had an opportunity because we had some really good volunteers. We have a lot of donations, but there were a couple different processes that made it very difficult for people to avail themselves of what was in the library. So I made everything free to keep. I made it self-service because sometimes we don't want to be bugged by that perfume counter person. We just want to look and choose for ourselves. And that's how I am. Yeah. I don't want people breathing down my neck saying, how can I help you? But I wanted to still be available if someone needed that help. So we just tailored it to that. And I started increasing the number of volunteers I had. I did a big process improvement project with modeling what one of my volunteers was already doing and improving it with assistive technology. And now we have over 24 volunteers who deliver to all of the units, to include the acute mental health units. I have volunteers who read to veterans as well. You know, not everybody wants a machine. If they can't see, they want a person. And we also work directly with some family members. We have some veterans, family members who come in and just sit with their veteran with dementia or who's in hospice, and we provide materials to the family members as well. And then, of course, the aspect of providing information that's educating for the the veteran or for their family members is really rewarding for me as well. Because I've been in that position where I have no idea what they just told me. And every veteran has more than one thing wrong with them. So it's nice to be able to share with them something that maybe can help along that path too.
I have about 20 things wrong with me.
I know. I think every single one of us, I say this to everybody, when you look at the research, one of the last things I want a provider to do is say, I'm dealing with a patient with this problem, so I'm going to read this article and this is how I'm going to treat them. Because every one of us has some circumstance and other issue that makes our health situation more complex than that.
Right.
And what's really nice is our providers get that. They really do. And so another aspect of my job, because I'm a military background, is that they'll say, what does this mean? If a patient said something like, squared away, they may not know what squared away means. They think it's just a really neat motto. I'm like, no, that's actually a very normal term that we use. So I get to help out in that way too, which is nice.
It's got to be super rewarding, like you said.
Yeah. I didn't expect to.
It's a good surprise.
Yeah. I didn't expect to be so satisfied by that, but I love it. Yeah.
That's awesome. 3 months ago.
Yeah.
Life was very different.
Yes.
So, what was Sarah doing? What was your life like 3 months ago, and what is it like today?
So, I think it was March 12th, actually, that I got a call, or I got a heads up from my supervisor, and then a call from the associate director saying, hey, would you be interested in doing this? And, I didn't have any hesitation because I've always been one of those people where if I can help, I feel a moral obligation to help. Mm-hmm. I think that's how many of us in the military feel. That's why we served. And it just gets strengthened when you serve. But I did know that it would come with some complications. And of course, we had no idea how long it was going to last. But I just sort of pushed that out of my mind and came into it with an approach I did when I had deployments, which is, okay, where do I go? Where do you need me? And so that's really how I went into it, which I think meant that I wasn't having a hard time adjusting. I think I was used to things being intense before in the military, so it doesn't feel that different. The only challenge for me is that I had to send my child to family, and because my hours are extremely long. And I'm not complaining because I'm very happy to be able to have an opportunity to use my very strange background for good. But that's the hardest part, is that I don't get to see my daughter except on FaceTime since I think the end of March. And but she's doing well. I'm very lucky. She's a real trooper. And I also don't think that I could look her in the eye if I didn't do something to help. Because I know what it felt like after 9/11, and I felt like that was really not something I wanted to repeat in my life ever, where I wasn't able to give everything I had to help out. And I had a conversation on Saturday with a fellow emergency manager down in Providence who, almost all of us are military background in emergency management, it seems, or in some way public service and first responder community. And he was in the Army as well, and he said, those are my guys in those beds. And I said, exactly. So it's not a torture. It's not a burden. It's an honor to be able to help out. And I truly believe that, because whether I was delivering a book or providing information to a staff member that might help with someone's care, I felt like I was taking care of my own, regardless of what era or what branch, despite how we make fun of each other's branches, there are comrades in arms. And, this is where I belong then. If I can help, that's what I want to do. And so I'm very grateful, even with the long hours and everything. It makes me very happy to be able to be a part of the response, and also to help out our leadership, because they take it very seriously. And, if the training that I had and the experiences I had can help out in any way, that's wonderful. So that hasn't changed. I think that's how I felt every day that I've been at the VA. It's just maybe even stronger, that gratitude that I get to use this strange background to help with something that's really uncharted for all of us.
Well, your level of passion is immense, let me tell you. On behalf of all the veterans you're helping out, thank you very much.
Oh, it's my pleasure, truly.
So how is the VA doing? How is VA Bedford doing in response to everything?
I think we're doing really well. I mean, one of the concerns that we all had was we saw what happened in Seattle with the nursing home, and we've seen what's happened at the soldiers' homes, and that is our biggest nightmare, that we would have an outbreak that we could not stop. And we have an extremely fragile group patient population. All of our veterans have at least one of the risk factors that puts them in the high risk category.
And you're referring to the 240 or so individuals who
live here.
Campus.
Yeah. I mean, the some of the biggest concerns that we have for health risks are COPD and diabetes.
Right.
And veterans usually have all of the chronic illnesses at a higher rate than any other aspect of the population. A lot of that is because of their exposures. Like Vietnam, there's a higher rate of diabetes among Vietnam veterans. So right then and there, they're more vulnerable. I think some of them are too tough to get sick, which is pretty cool. But there are others that were quite fragile, and we were worried about that. What's really hard is that, like when H1N1 first came out, COVID or SARS-CoV and COVID-19 behave differently than what you might assume. Like flu, it's usually the eldest and the youngest. It's not that clear cut. H1N1, it was everyone who was young, that was the highest risk category. Here, it's people with certain chronic illnesses that our veterans have. And so we were really concerned that we would get an exposure. And the other thing too that we were nervous about is that we might have shortages with PPE because we saw that happening around the country.
Right.
We had that sense of uncertainty, like really, how does this get transmitted? And so there were all these questions that we had, and a lot of conversations and a lot of planning about how we can mitigate this threat to our veterans. And like everybody around the country, what we've learned is that there's a lot more chance of exposure with no symptoms than we realized. And so that's been the real weakness, I think, for healthcare, is that you may have an employee who comes in not knowing that they've been exposed. They're not sick or anything, and they unwittingly expose other people. And that's really what's happened in nursing homes. That's really what's happened across the board in healthcare. And certainly here, where we had staff who are well-meaning, had no symptoms whatsoever, but we do think that may have been a way that some of our veterans got sick. But we very quickly responded and set up COVID units. Our first one actually was in response to what was happening in Chelsea at the soldiers' home there. So while we were already getting ready in anticipation of a need to have COVID positive units, because we knew that it was a likelihood that we'd have COVID patients at some time, under very short notice, the VA really responded in its fourth mission to help out community veterans and community organizations. And that's I feel a real sense of pride about being part of an organization that was able to step in and help. And so we brought 10 Chelsea Soldiers Home veterans here. Last week we had another one go home, and he's a World War II veteran. And he must have been like a kid when he was in World War II, but he was awesome. And he was slapping high five with us and everything, and, just doing great. And we have one more still in house. And I think we've done a really great job. In fact, we want her to stay. We wanted the last guy to stay too, because they're just these awesome veterans that we just think we need to see them every day because we've really fallen in love with them. But that's one of the strong things about our staff here is they do actually love their veterans. They feel like they're part of their family. They see them every day, sometimes for decades, and they get to know their family members. And that's where I think a lot of our strength has come from, is that commitment to a veteran, whether our staff had served or not, because they feel like they're their own loved one. But above and beyond that, they also have done everything they can to make sure that they know how to treat with the latest guidance, how to protect themselves and their veterans with the latest guidance, and really, making sure that we reduce any risks that we can. And the more, when we try to keep up with information all the time. So that's where my librarian hat comes back in. And I'm still doing the literature alert for the VA on the coronavirus and COVID-19. And so I like sharing that information, and our staff just are sponges. They just take that information and then they put it into practice, what elements they need to be able to provide great care. So I feel very strongly that, Bedford's done a great job. what's really been wonderful from the emergency management side was that the whole VA, and certainly within VISN, all the emergency managers work together. All of the logistics people work together. Where there's a need to cross-level supplies or equipment, they've done it. We have not suffered the shortages that you see in other places of the country. And it's because of cooperation. It's not just because someone said, I'm going to take care of my own. We've really, really helped each other out. And we've helped out community organizations as well. And not just with equipment and supplies. We have more than 35 staff members from throughout VISN 1 here helping out at Bedford because we have staff members who are home sick with COVID. And so across the region, this region's just really pulled together to provide great support where the need has been. So that's pretty awesome to see.
So earlier today, actually, I spoke with a gentleman who is a nurse at your facility, who was a part of the team or teams of individuals who have been traveling to New York to help out,
right?
Whether it's for a week, 2 weeks, or however long they choose to be there, I guess. Has that been something that this facility, I mean, I know he went.
Yeah.
Are there a lot of individuals who have been volunteering to go down there?
We actually have had a lot of people volunteer, but we've not been able to let all of them go who've wanted to go because we also have so many people who need care here.
You have your own shortages.
We have our own shortages due to staff who've gotten sick from community spread.
Right.
So we did send 2 nurses, one an ER nurse, Carla Calnan, who was also military, and Mark Zakis, who was in an ICU, and he also was military. So there definitely have been quite a few people who are former military who have volunteered, but also a lot of non-military all these VA staff members who just want to help out wherever they can help. We received taskings for New Orleans, New York, New Jersey, and several other places. And we've had an abundance of volunteers. We ended up only sending 2 nurses to New York, one being Mark, the other being Carla. They were on different shifts, but every once in a while would pass each other in the 2 weeks that they were there. I'm sure Mark's told you, I mean, it was kind of an intense experience, but really wonderful that they were willing to answer that call. And that was still when we didn't know as much as we know even now about COVID-19 and whether or not they were going into a really risky experience. Both of them came back, negative from COVID. We've tested them both twice and they're fine. And both of them said very enthusiastically how much they were grateful that they got to help out.
Yeah.
And they had they were working at a VA hospital, as a matter of fact, in New York. And they had some really incredible and some sad stories to talk about, veterans who'd become sick, but some real amazing successes too, where a young veteran, couldn't even move his arms and was sick for weeks. And then finally, the last week that Mark was there, he saw the man walk out. And so I think there's no greater success than being able to know that somebody's been able to regain their strength and recover from this. So we have recently sent actually an HVAC mechanic down to New Jersey. He got there on Sunday. But we're not going to be sending large numbers out just because we do have our own population that we're supporting, both who have COVID and who don't have COVID. We have to make sure that we have enough staff here. But down the road, I'm sure that there'll be continuing DEMPS missions that we'll want to participate in. We're certainly benefiting from them as well. As I mentioned before, the VA's really rallied a lot of staff to come help us out, and in impressively quick and efficient fashion too. So I put in the request, and within 2 days we had all those requests completely filled and people already lined up to come here. And so they all showed up yesterday, and this huge crowd from all over the VISN in Building 1 ready to go out onto the units. It was awesome. Yeah.
That's the nice thing about having such a large organization. I mean, it's not, it's some of the hospitals that are out in the public.
Right.
They only have one location or maybe 3 locations to pull from, but we've got, on a national scale, we've got hundreds.
We do. And we don't even have to pull from them. That's the real, I think that's the real testament to our culture in the VA. There's in other nursing home settings, there's 30%, at least 30% AWOL of staff. We not only don't have that, we have additional staff who are volunteering to come help. We have people who are coming off of retirement to come help. People who are knocking on our door before we even asked, saying, do you need me? Can I be available for you? So that, I think, is, that's the type of person that we have on staff here. That's the type of people that the VA ends up having on hand to help out our veterans. And so that's, of course, just beautiful to see.
Yeah, in the past 2 weeks, I want to say it was between 800 to 900 individuals who are retired.
Yeah.
Who came back to help out,
right,
to take care of veterans, which is...
That's awesome.
It's mind-numbing.
It is.
And we were able to hire all those people in 2 weeks. That's even more mind-numbing, but...
Yeah, and that, again, is because our leadership really put processes into place to allow us to do that. We weren't stuck in bureaucracy. We have been able to be very responsive because of that. So
a lot of people that are out there think that the VA is just about the veteran, and that's it.
Right.
And I've done some myths. I have some videos about myths about VA healthcare and all that kind of stuff that people could check out. But there are services and what have you that are available for family members.
Absolutely.
So, I mean, if there's a family of a veteran who has COVID-19 or unfortunately has passed away due to COVID-19, what kind of support can they expect, or what kind of support can they reach out to the VA for?
Yeah, so at Bedford, across the VA, there's different programs, but many of them are the same at different locations. So, I mentioned that we have a large permanent population of veterans who live here. And our staff get to know their families really well. That's not just because they're friendly. It's because they really want to involve the family members to ensure that they're achieving the family's goals for their veterans care. So our staff, and that may be because they have to be the proxy for someone, like if a veteran isn't able to make their own decisions due to dementia or another condition, a family member or a friend might be identified as a healthcare proxy. But we also just develop that relationship with the family members because the family is an integral part of that veteran's well-being. So our staff every day, not just now during this crisis, are very much in communication with family members, whether they're a permanent resident here at Bedford or if they're just a temporary one who comes through, after going to a hospital and before they go home. We have conversations with family members, sometimes almost daily, and sometimes even more than daily, where it will be by email and phone calls with the social worker or with the whole care team to make sure that the families are informed, and also to make sure that if someone's being discharged to go home, that there are sufficient support systems in place, not just for the veteran, but also for the family member. A lot of the illnesses that our veterans are challenged with are very difficult. In particular, things like dementia can cause ridiculous amounts of stress on a caregiver. And I know that we've got programs for caregivers. We have support groups for caregivers. We have support groups for families whose loved one is in hospice. And I know many family members who continue coming to those even after their veteran has passed because they develop a community. There's counseling that both family members and veterans can attend, and sometimes individually and together, so that they can provide the best care for that veteran. And then during COVID-19, that's just ramped up even further. So anytime that we've even so we've done baseline testing in the VA. The VA has really leaned forward to do testing across its CLC, our community living center, to make sure that we identify before symptoms appear, or if they'll never appear. We want to know who has COVID among our staff and our veterans. Before we did any of those tests, every single family member was called to let them know and to get their consent if they were the healthcare proxy. But even if they weren't the healthcare proxy, we still informed them because we recognize that this is a really scary situation, and it's not like taking someone's blood. It's not like doing, a regular, everyday test or, checking their insulin levels. This is a totally different situation. So we're very mindful of that. Every week, we also have at least 2 calls. They're basically like town halls with the family members. The director, our chief of staff, our social work chief, some of our other social workers, and myself and other individuals are on those calls, so we can update the families and give them situational awareness and answer their questions. We send them a newsletter as well. For the CLC veterans families, we have an email that they can send email or an email address so they can send questions in. And we have a hotline that they can call, and they can either leave us questions they want us to respond to at that town hall, or they can call and say, I want to know how my husband's doing. I want to know how my dad's doing. And they'll get a call back. If the call's not answered immediately, they'll get a call back from a social worker who will let them know everything that's going on to keep them fully informed. But on top of that, again, the library thing comes back in. I had iPads that the VA Mobile had retired because they were old iPads, but they didn't want to just throw them out or recycle them. They offered them up as, free resources for other services. So I got a number of those and have been using them as part of my library program. We're using those now for our veterans for their own entertainment, if they're, because they're not able to leave their units and they're not able to see family. They're using those maybe for entertainment purposes, but also to do Skype with family members. And so we have all these iPads out on the units that veterans can use to Skype with family and friends. And then our telehealth department has done the same thing. Again, across the VA, they've done this initiative, not just for their health purposes, but also to provide them that communication, because that connection with family and with friends is as much a part of their well-being as their medical care.
Oh, most certainly. Yeah.
Yeah, because isolation and loneliness are really very difficult. Yep. For anyone, but particularly, many of our veterans. So we've tried to mitigate that with that. And then, of course, our staff are here. Many of the staff are here, not just teleworking, but physically on the units, spending time with the veterans and getting to know them. And, if we've had to cross-level staff from other units, they spend the time to get to know the veteran and treat them as an individual, so that they can then also tell the family members, I got to sit with your husband or your son, and this is what's going on, and or your daughter's doing well, and when she won't leave her room unless she has her lipstick, but that's okay, we got her covered. And we have one of those, and it's great. Like, I think we're trying to really personalize that care, like we always do, regardless of how this crisis is going.
Yeah, you brought up one of the things that, in my mind, when you said it, telehealth, it really surprised me when I first started with the VA, because, especially now, you're seeing so many urgent care clinics and doctors and whomever beginning to do telehealth who had never done it before.
Right.
And because I've never used healthcare in the private sector.
Yeah.
I'm a disabled veteran. I'm able to use VA healthcare, and I have. And I'm like, man, I didn't realize, VA's been doing telehealth for years.
Always, yes. Yeah. And it goes into that accessibility, that commitment to accessibility. For a variety of reasons, not all veterans can come in for care. They may just not want to. There could be a mental health component that makes it really difficult for them. And the VA does whatever it can to really provide those resources in the format that works best. They've expanded it immensely during this crisis. And not just because it's safer for veterans to stay home, but also so that our staff can be available in a more exponential fashion. So if we have someone who's out sick, then someone else can cover them because they can do it by telehealth.
Right.
And so that's many of our mental health services are happening in that way. So instead of having a group sit in a room, they're doing it by telehealth. Or if they're, meeting with a patient, again, so that they're not exposing that patient, to a potential risk, they're doing it by telehealth. And so it's just following guidelines, but doing it in a fashion that still fulfills the continuum of care.
It's crazy.
Yeah, it's great. One more thing, actually, about that, which I was really impressed with that the VA did, is that they've increased our ability to provide telehealth for veterans who maybe don't have computers or phones at home or are not comfortable with that. We actually have stations within the entry areas of the VA here at Bedford so that veterans who maybe don't have a computer, don't have a phone with a camera, or don't have comfort with technology can come use that telehealth clinic right there at the VA and communicate with their clinician that they have a relationship with. So there's still that ability for them to reach out even if they don't have the technology themselves.
So they can go to the nearest facility as opposed to having to
right. So they still make an appointment, but yes, they can do it that way, and they can have appointments. So, we don't want a veteran, if they don't have a computer at home, to just not get care,
right.
Which has been a challenge in the private sector, I think, in some cases. So instead, we set up stations so that anyone can still get care. We just we're providing them the technology to do it.
Did you think all this would be on your plate?
No, but it's really awesome to see it. I sometimes still feel like it's completely surreal that this is going on. And we're still always seeing ways that we want to improve things. I mean, every day we're trying to find those best practices and perpetuate them and share them within our facility, but even to other colleagues. And some things always come back. I will say, like, the slides we use for our command and general staff meeting in the morning are suspiciously like what we used to use in the Army, because the associate director in Providence also was Army, and his slides, I sort of took those from his emergency manager and Bedfordized them. But it's interesting to see how things from my past experience and so many of our past experiences have come to be of use again, but in a more updated and efficient fashion. So it's nice to see that evolution. And I feel like the VA's really been responsive. I mean, it's just an enormous healthcare organization. And yet it's agile enough to respond to something that's changing every day.
Right.
And with some of the absolutely most vulnerable patients, but not just helping out our own, but reaching out and helping out the community. I think in 38 states, Secretary Wilkie had said we've also helped out our communities, whether veterans or non-veterans. And I didn't expect that, but it makes me very proud.
No, me too. So if there's someone out there right now, and I mean, there's a lot of people that are thankfully doing stuff out of the kindness of their heart.
Yes.
Whether it's, I've seen so many hearts and windows and stuff like that.
Yeah.
That's cool.
Yeah.
But a lot of people are looking for ways to give time or donate things or whatever the case may be. And most recently I saw a post, actually, I think it was from this facility, from Bedford, with regard to bringing in movies, so DVDs and Blu-rays and stuff like that for veterans to be able to watch that are living here.
Right.
This is their home. So what are some of the things that people, if they want to get involved, but do it from a distance,
right?
How can they do that?
Yeah. So my volunteers ask me this all the time too, because they really miss being able to come in, but because of out of an abundance of precaution and really, a best practice, we're not allowing visitors and volunteers to come in and bring things. But what we've been telling people is there are a number of different ways that they can assist. We have, so my library, of course, had some movies and books that we've been using already, but we've told people if, there's other DVDs or CDs that they want to share, that's wonderful. iPads are always in demand, and little DVD players so people can watch movies. So I know a lot of our veterans have those, but they're definitely something that's useful to our veterans. And we have Operation Mail Drop. So that's a very low cost way of showing support to both our staff and our veterans. That's on the Bedford Facebook page. But it's a way for people to write a letter of support or send in a sign. I've talked to several community organizations like the Lexington Veterans Association and also the Boston area FBI alumni. They sent in signs that we've put up in the different break areas and in the screening areas. And that's just a really great way to show our veterans and our staff support, because we're not in the middle of a city where people might be, honking their horns all the time at healthcare every, at 7 p.m. like they do in New York. We're in really in a small community. So sometimes we can feel like we're a bit of an island fighting this battle. And it's nice when we get that vote of support from our community and from whether they're veterans or not. It's just really nice to know that they've got our back. So Operation Mail Drop's a great way. And then just today, we sent a wish list to the voluntary services, and I believe they'll be posting it. Many of our staff need things too. They're wearing PPE all the time. And so like staff anywhere in healthcare, if they're wearing respirators all the time, their faces start getting injured actually from all of that. And so we have a wish list of certain items that would be very useful to our staff to help them prevent scarring and other discomfort. So those are some of the easy ways. Another real important way is face coverings, because the VA is encouraging anyone coming, whether they're veteran or staff, to be wearing a face mask when they come in. Not all our veterans have face coverings to wear if they're coming in for an appointment. And so I know people have reached out to me and asked if they can send in cloth masks, and those can be sent in, and we can use those for people who are coming to the VA to wear when they're in the facility, or for veterans themselves. And we're really lucky, the community we're in. The library that I have here is successful really because of that community. My whole library is through donations, not the medical library, but the library that's for the veterans. All the books, all the DVDs, all the puzzles, all of those are donations we get from the community. You've seen it. Even the artwork is from veterans, and it's really incredible, the passion within our community to help our veterans. So I'm hoping that means that we'd have the same, ability to provide for our veterans now. And by the looks of things, by what we're seeing in the mailroom and what we're seeing with the donations we're getting coming in, we certainly do still have that support, which is great.
That's awesome. Mm-hmm. And it's also great to have you.
Thank you.
On board. As busy as you are, thank you so much for giving us this time to discuss this topic that a lot of people have been wondering about. So Sarah, thank you for your service. Thank you for your continued service.
Thank you.
At the VA. And thank you very much for coming on the podcast.
It was my pleasure. Thank you.